Adagio Health, and your presenters are Rachel, Lohr, and Dr. Koehler. So Rachel is a licensed social worker with an MSW from Edinburgh University. She emphasizes holistic healing through both physical and mental health practices. Her areas of expertise include interpersonal violence, self-esteem and body image issues, substance use, and anger management techniques. Recently, she opened a private practice to provide services for those in need of overall mind-body well-being. And Dr. Koehler is an associate professor of social work at Edinburgh University. He maintains a private counseling practice and is a consultant for trauma-informed care for individuals, couples, and families. His areas of expertise is mental health, care for LGBT individuals, specifically focused on assisting transgender people with their transition, and HIV-positive people navigate stigma and discrimination. So this should be a pretty awesome session. So give them a hand and welcome.
So I'll let Rachel introduce herself first. I know you just read the next one.
Yeah, so that was a really good blurb. I was
like, wow, Rachel.
I know, I was like, I seem really impressive. That's nice. My name is Rachel. She, her pronouns. I was born and raised in Ticeville, small town, moved to Erie, a little bigger small town. So there's still that mentality there, which is something we are definitely trying to combat. But I've been a domestic violence counselor, I've been a substance use counselor. I interned under Dr. Koehler, and that's how we met with the Greater Erie Alliance, and very strong passion for this population. A lot of my family members identify along this population, so it's always been something growing up. It's not been strange to me. So when I interned under Dr. Koehler, I said, I want to be like you. How do I be like you? So he taught me, and here we are today. So that's a little about me. I also love cats. I have 2 ferrets and an iguana, and I play Dungeons and Dragons.
Pronouns?
I said she, her.
All right. My pronouns are he, him, and we are here to talk about making change in a community. And so we're going to be talking a lot about our community, which is, we'll get to some statistics about Erie a little bit later. But I also want us to be able to help you translate those into your community, the things that we've done and are trying to do, building bridges and relationships to reduce barriers to mental health and other services for LGBT people. Also, these things are probably going to fall down, but it'll add to the flair of our presentation. So in order to get an understanding of what communities you might be thinking about, can I just see a show of hands? How many people are from Pittsburgh proper? All right, so taking what we've done is kind of taking a lot of what PERSAD and other organizations in Pittsburgh have done and translating it into a smaller community. So knowing that I receive a lot of referrals from Pittsburgh providers like Central Outreach, and for people that are either living somewhere between Erie and Pittsburgh along the 79 corridor, or out in the middle of the rural communities, making their way into one of our cities is kind of difficult, and so we're hoping that you may be able to bring those, what you're learning today and what you're thinking about today, into other communities that have more difficulty getting in towards our city centers. So our 3 main objectives are to discuss the mental health services for LGBT folk in a small community, discuss strategies to address identified needs, and facilitate brainstorming for other communities, like the ones that you are from or in or aware of. So we wanted to give you a little orientation. How many of us are from Erie? Right. So a few of us. Our population as a county is close to about 280,000 people. 2/3 of those people live within the city limits, and probably another significant portion of the population live in the immediate townships around the city. So having people that are in the extreme outskirts of our community and county also struggle to get into the city because we tend to be blind to the other smaller communities as far as service provision. Think, oh, well, they can just drive in here. Well, we have a lot of people that we work with that don't have public, or that rely on public transportation as it is, and so
Might be one bus that goes out their way a day. And
Yeah.
If that.
So the average household income in our county, I think these are 2018 figures, is about $45,000 a year per household. And in the city, the specific zip code, it's one of about 6 zip codes in our city limits, is $11,000 annual household income. Compared to the national average of $62,000 and the state average of $57,000, we live in a pretty impoverished community, particularly the 16501 zip code is rated second poorest in the country, according to Insider.com. The poorest zip code in the country is now outside of Decatur, Georgia, I think. We were number 1 for a while, so yeah, go here. Just a few more statistics. We're about on par for percentage of people that graduate high school, hold a high school or diploma or GED, or 25% of us hold a bachelor's degree or have some higher education beyond high school or GED. That's about average nationally. Being a person of color in Erie community, even though we are one of the settlement communities for immigrants and refugees because of our low cost of living and affordable housing, being a person of color in our communities is extremely difficult. I don't remember the source, but last year it was kind of all over our news. We were rated one of the worst cities for a person of color to live in the country. So again, yay us. We're number 1 on 2 great things, right? So this just gives you an idea of the type of community that we are coming from and what we've been doing as an organization for LGBT people in this setting. So in order to give you some sort of framework, in 2015, GEAE partnered with Edinburgh University Social Work Department. Convenient that I work for the Social Work Department and was also the president of GEAE at the time. Good partnership. Conducted a 2-phase LGBT community needs assessment. The first phase was gathering together community stakeholders, people from other LGBT organizations, people that had been working in this community and with this population for generations really, or had vested interest, and brought them around the table and said, okay, what are we seeing? What are the needs? What's going on here? What do we need to work on? What is going well? What is not? And together, after I think 3 or 4 of those roundtable discussions, we formulated a 54-question survey that we put out to the general public over the course of a year, going to the Gay Pride Festival, the Erie Gay Pride Picnic, the Erie Sisters and Brothers Gala, some different events, passing out and distributing these surveys. We also developed an online version, put it out on social media, asked people to complete it, and just, again, asking them, what are you seeing? What needs are met? What needs need to be met still? Or do you know what's going on in your own community with different parts of the LGBT community? So the results, we had 30 focus group participants and 250 completed surveys. These are our findings. As far as gender identity, we had, if you add up all these numbers, they don't equal 100%, so don't even bother. It's not because I don't know how to add. although that's a struggle. But 41% identified as male, a little bit more identified as female, 10.5% identified as either trans, genderqueer, fluid, or non-binary. The other percentage either didn't respond or responded with some other category that we collapsed into. So sexual orientation, we had a large number, more than a quarter, identified as heterosexual. So we thought that that was a good number of allies to capture, rather than just asking what the LGBT community was seeing. We also got a good perspective of people that consider themselves to be allies. What are they seeing and what do they know and think in our community? We had a lower number of people identifying as lesbian and as bisexual, but considering the distribution, we thought that we had a pretty good distribution in regard to the population that we were seeing in the community in general. So some of these things, we weren't allowed to survey people under the age of 18 due to the Institutional Review Board standards of our project. However, the average age was about 41. Household size was a little under 2 people. Household income was in this range. We chose ranges defined by the US Census in order to have them checked. So what this supports is that the average income for the LGBT community is still lower than the average income for an Erie County resident, which is, yes.
Just a quick question.
Yeah.
The 27% identified as heterosexual.
Yeah.
Do those exclusively allies, or could those also be trans people who identify as heterosexual?
Yes, it could be as well. Yes. So just supporting the idea, although we didn't intend to gather this information, so it's not exactly accurate necessarily, it supports the idea that LGBT people in general earn less and have less economic power in communities than heterosexual and cisgender populations. So some quantitative findings of our results. It's a lot of numbers and percentages. I think I want to draw your attention to 2 columns in particular. One is the unsure column. It's a high percentage of respondents were unsure about various needs. Those that were sure, in general, thought that very few thought that the need was completely met for these various issues. Some other questions that we asked were in regard to LGBT and trans competent healthcare, HIV testing and prevention, HIV positive care, suicide and bullying prevention, safe space for youth, adults, older adults, legal advice, shelter services, medical nursing, rehab services. We tried to break down into the population subgroups such as youth and older adults, and asking specific about trans competence services. That was something that we were interested in an effort to stop lumping everybody in as a homogeneous block of people. So some of our findings, kind of qualitatively, those who did utilize the services in general felt that their needs were not being met. The allies or the other LGBT community members, so in other words, if you asked an identifying gay man, lesbian, or bisexual person what they thought about the needs of trans people, or if you asked an older adult what they thought about the needs of youth, in general, allies of that specific population were unaware. So they may be supportive and they may want to be helpful, but they just didn't know. They didn't know, like, it's not a typical conversation allies have with their LGBT friends is, what do you need, or what are your experiences in healthcare or in shelter services? The providers and the allies, while well-meaning, just were not aware. So again, service providers were largely unaware of the lack of services or of negative experiences. In general, education, outreach, and prevention efforts fell flat. They missed the mark, only because through further conversation, agencies and professionals and providers are busy, and they're constantly being met with or faced with lots of needs that they don't know how to meet. Education efforts like through Trans Family, Greater Erie Alliance for Equality, PERSAD has done a lot of training in our area as well. We're maybe able to start the conversations, but it would be difficult for the providers to continue the conversations that would start. Common experience for us is we would set up a 2-hour training for an agency or a group of people. We would come in and we would get a third of the way through the material that we had presented, just because we got stuck at, well, what does this term mean? Or how do I ask this question? And it was, people were hungry for the information, but it was just so overwhelming by the time they finally got to a safe place to ask questions that they just had so many. And so getting us to come back and scheduling that was often an ongoing issue. We also understood that there were no safe spaces or places for expression of need for LGBT people. There were there were maybe still 2 gay bars or LGBT friendly, specifically catering to that population, but there were no safe spaces that were just socializing that weren't associated with alcohol or
like
youth friendly, those that were in recovery, older adults that didn't necessarily want the bar scene, or people who didn't smoke. The one gay bar in particular was still smoking, even though other bars in the area were not. LGBT people of color were grossly underrepresented, as were LGBT people with differing abilities in our survey and our data collection. Their voices were not being captured. We were not hearing what they had to say. So, how do we have strategies? What did we do about this once we kind of realized this as a community, what we were faced with? We decided as an organization to establish a baseline. We used the Human Rights Campaign Municipal Equality Index. Are you all familiar with the Municipal Equality Index? Are you all familiar with the Human Rights Campaign? Okay. The HRC has different indexes they use to measure, like they have a corporate equality index to measure how well your corporation meets LGBT standards for that industry. Do you provide competent services? Do you have policies that are inclusive of trans individuals? Do you provide medical care for same-sex partners? Those types of things, and they measure that against other corporations. So they do the same for municipalities. It's a voluntary assessment. 2015, to the best of our knowledge, was the first year that somebody submitted to the HRC Erie's municipal equality rating. We were rated at 57% back in 2015. However, no one in the LGBT community had any idea who it was that turned that in. Yeah, did you find that out?
I actually think nobody in the community did. They just did their own research on kind of policies and stuff.
Okay. Yeah.
I asked them about it.
Yeah, when we finally got them on the phone, they were telling us, oh, this is voluntary and we don't know. And so it took us a couple of years to find out that even who was responsible for doing this. They said, we just mail surveys out. And, yeah.
A lot of times they do their research on their own.
Yeah. So that was the situation. We weren't aware, but we just noticed hey, we're rated, and in the cities that were rated in Pennsylvania, we were the last ranked at 57%. So we decided we would use that as our benchmark and as our goal. Our 5-year plan was to see if we could increase that to 100%. And we conducted a SWOT analysis of our organization and of the differing partnering agencies and key stakeholders in our community as well. We prioritized our needs, strategized, collaborated, planned, tried to implement the plan, and then came back, evaluated how are things going, what adjustments do we need to make, what other bridges do we need to build, what other events that have happened policy-wise, politically, on a national level, on a state level, on a municipal, county, and city level do we need to account for, and how are things going. So establish the baseline. I think we already talked a little bit about this. So just as an update, in June of 2018, the city mayor, Joe Schember, he was just elected the previous year, established an LGBT advisory council. I think we have at least one member of that council here, Caitlin. And there were 30 people on the council, accepting the task of, among other things, increasing Erie's floundering MEI. In April of 2019, GEAE, among other key stakeholders, were invited into a conference call between the HRC and the city. To our knowledge, this marks the first time there was a reliable measure of our municipal quality index, because there was a conversation between the HRC and the city, the mayor's office and city personnel. We did, well, I don't want to say we exactly, but Caitlin was interning for a county council member at the time, or a couple of years before. She was doing some research as to, we as a community a lot of our measures are based on the county policies, privileges, needs, etc. Where is that represented in this municipal quality index? And she did a lot of work with council member Jay Brenneman. Speak about that. Yeah.
The problem was that a lot of the measures that are on the MEI are based on municipality and based on how localities are structured, I guess. Erie County is not considered a municipality, Erie City is. So we had good scores on the county side, but not the city side, which dragged us down. For example, Columbus, Ohio, they are very, very accepting. It's a great place to live, within the city, or, in the county. All their policies are also at the county level, so they have like 100% effectively at the county level, but almost 0 at the city level. So but everybody's still covered by all those policies.
Yeah. So part of it was navigating the conversation with a national organization about how are you measuring our community when you do not know our community, and if one person that doesn't necessarily know our community but happens to receive the survey in the mail, fills it out without asking anybody that's in the community, how is that an accurate measure? And so it was interesting, the conversation at the mayor's office a couple of months ago. It bordered on becoming, how do we check this thing off of the list? And then there were people at the table that were saying, well, it's also important to actually make the change and have the community transform into a safer place for people regardless of their sexual orientation and gender identity. And so the people in HR at the courthouse and the mayor's office were a little more like, well, how do we just check this box off so that we can get this rating up, so that we can get more positive ratings and bring more people in and have it. Yes, that is important. It is important to advertise that you're a safe and friendly place, but it is also important to make sure that you are not falsely advertising that you're a safe and friendly place. So that conversation is at least happening, and we're very grateful for that, but it's a slow process, right? Community transformation is a very slow process, and for people that are caught in the middle, that's not always a great excuse to offer. So something that we determined in our SWOT analysis was that while the vast majority of people on the survey said an LGBT center would be a great way to meet all of these needs, and we would support it, and we would show up, and we would send our friends, and we would give money, and all of this stuff, the Greater Erie Alliance for Equality determined that we probably wouldn't be able to sustain that after a year or two at the most at that present time. So if an LGBT center isn't the answer now, and we may want that to be an answer in the future, what do we need to do in order to get from where we are now to where we think we want to be and where the community says we need to be? So we developed this plan. But in so doing, we wanted to build stronger bridges between the organizations that were already doing things, such as the Office of Children and Youth Services. We're servicing all of the children in need, adjudicated dependent children in our community. How can we help them be better serving of LGBT youth in our community? Community Shelter Services are serving all people in need of emergency shelter services and homeless shelters and transitional housing. How can we help them better meet the needs of LGBT people in need of those services? So that was the approach that we took through education, outreach, advocacy, having those consulting conversations. The disclaimer that I wanted to add here is that Greater Area Alliance for Equality took this on as our mission, but we weren't the only entities doing this in the community. There were other people. Caitlin, for example, Tyler Titus, who you heard from this morning. There are other key stakeholders and organizations. I think I mentioned before, Prasad was involved in a lot of training in agencies in our area. So we weren't the only ones. We were trying to collaborate, but we wanted to acknowledge that it wasn't just us doing all of the hard work. So prioritizing needs, the first thing we looked at is where are people not safe? Where are people not experiencing safety in our communities? Residential facilities. Entry points into services were another place where they were either being denied or experiencing feelings of unsafe or being treated in unsafe ways that were perpetuating the problems. Mental health services were another key focus for us, for youth, vulnerable adults, and those who were transitioning. And so this is where I'm going to stop talking so much, and I'll have my co-presenter share a little bit. I asked Rachel to think particularly about some of the work that she has been doing in the community with the Northwest Alliance. The Northwest HIV Alliance, do you all work with them in Allegheny County? They're based out of Clarion County, and they serve a number of, I think, 18 counties in Northwest. Rural. Okay, yeah. I'm never sure what their name is anymore because they got outwards because of stigma and things like that. So we began building a relationship with the Northwest Rural HIV Alliance, put those words in the right order. And they came on as sponsoring one of GEAE's symposiums to educate community members regarding certain issues that we would have every other year. The next thing that we were able to establish is they realized that a lot of their HIV positive clients were not accessing mental health care due to the stigma not only of being LGBT or being people of lower socioeconomic classes or other intersectionality, but particularly because of the stigma of being HIV positive. In addition to that, the clinics, the mental health clinics where they could receive services, because the majority of them had Medicare or Medicaid coverage, were overflowing with need. Mental health appointments were
3 months or more.
psychiatric consults were 3 months. Intakes were on a walk-in basis only. That was the only way that you could schedule a follow-up appointment, and sometimes those were 3 or 4 weeks out for a mental health counselor. Very overloaded. So they gave us an opportunity. They contracted with us. They found some money to contract with a few mental health providers to provide in-home mental health counseling services, which Medicaid and Medicare do not permit, to provide and pay for counseling in the Northwest Alliance office in Erie. They began to grow services, provide unique opportunities for their patients and clients to access mental health services. So just to give you a general idea of what that looks like in real people's lives, Rachel has been working on this project for over a year now, and I asked her to share a little bit about some of those experiences.
So Will brought me on when he realized that his caseload with the Northwest Alliance was becoming too much for him to handle, and he said, hey, I need some help. People need help me out. So I said, absolutely, 100%. So he brought me on, and I probably have a caseload, on and off, yeah, like between 12 and 15. And I would say about half of them I go to their homes, their residences, and meet with them there. I do have individuals who are of different ability status. I have people who are different races, different ages, all over the spectrum. And so it's really been a wonderful opportunity to get to know everybody personally and what their stories are and what can I do to help you. Specifically with some of my LGBTQ identifying individuals, I have a few, one specifically who is often in crisis due to families not supportive. We will often meet outside the home or at the Alliance office, which is a great resource. But oftentimes I do find that because that wait list for our mental health services in Erie is so long, to even get them in the door could be months at a time. So thankfully for us, we do not bill insurance. So they can see us and still attend their psychiatric appointments, which is such a blessing. So being able to bridge that gap, I often find that because those wait lists are so long for the mental health services, those wait lists for blended case managers, people to help bridge that gap. Yeah, we're not in our hands, we know about BCMs. So getting those BCMs is a long time, and it's a long process. And so I find that I'm often somewhat of like a BCM to help them, because when I first meet with them, oftentimes they have an appointment coming up in 2 months, or they haven't even done an intake, or they've never received mental health services in the area at all. And so it's very much, okay, what do you need and how can I get you there? What are the resources that we can get you to? And I may not be able to drive you, but let's create an appointment. Let's look at the bus system. Let's look at the schedule. When is your availability? Do you work? I will meet you outside of your work times. I'll meet you, if you feel comfortable, like I'll meet you at a Starbucks just so you can have some space away. We can plan for the rest of your week or something like that. And so giving that stability to individuals who have not had that before, it's really beautiful to see flourishment and see like, oh, when I actually have somebody who can be a baseline for me, who can be that support. If I need something, I can text you. I can call you if I need to. I know that I have one person that I see every week or every other week that I know is gonna listen and care and actually give a crap about what is going on in my life. So that's been a really big thing, is to be able to provide that in-home service. I have individuals who, to go to the Alliance office, would require getting on the lift, which is a whole process in itself, and it's a half a day to see me for an hour. So to be able to go there and bridge that gap and see people who have not been able to receive services or have never received services feel comfortable and being able to make phone calls with them and support them as they do it. Because half the time I'll ask, well, have you called them? And they're like, no, I've never spoken to anybody about, you know, the needs that I have, because they're scared or because they feel like they have been judged. I have a lot of my clients who are just thankful for any kind of direction and any kind of support. So that's been a huge, wonderful, fulfilling thing that I get to see with these clients who get to flourish when they have been stuck in their homes or just not talk to anybody about anything in their lives. So that's been really, really wonderful. Yeah.
I think another positive result of this relationship that has been able to be forged and is continuing to grow is that people can have a warm handoff. Like a new diagnosis can often be, is often a point of crisis for that person. It's a understanding that they've been infected, just learning that, or that they have just, now they have an official HIV or AIDS diagnosis as opposed to HIV, can be a point of crisis. And to have to call a mental health clinic and say, I'd like to set up an appointment, well, no, can you come in for, a walk-in, or that is so many barriers right there. To have somebody sitting in the office or in the safe space that they have right down this hallway and say, hey, I have somebody that might be able to talk to you just for a few minutes, and go from a warm handoff from the doctor, from the case manager, right to a mental health professional has been nothing short of life-saving in some cases, and then it gives a chance to build that relationship from the start as opposed to, waiting for weeks or a month or longer.
Yeah, I've had some caseworkers call me and say, hey, so-and-so's gonna come in. They're really hesitant to talk to anybody. And so even when I just walk in and say, hi, I'm Rachel, like, introduce myself, kind of what I do, like, how are you feeling, how are you doing? And it's less of a, let's talk about your mental health right now, and more of a, this is what I do, let me help you if I can. And I've had clients who are like, you doing that and just putting yourself out there and being like, this is my face, this is what I can offer. Like, I can just be somebody you talk to for a little bit until you feel comfortable delving into that. I think that's been a huge help as well. And so having a good relationship with the caseworkers and being able to have that office and go into the office and, I'm here, do you have any referrals? Do you have anybody else? Do you need anybody to call? And thankfully, because there's Will and myself, and Tyler does some work with us as well, if somebody has a preference for a female therapist or a male therapist, or to see someone in their homes, or telecommunication, we started doing that. And so it's like we have, if you need help, we can literally get it to you however you need us to do. And so that's been a huge help, I think, in bridging all kinds of barriers.
We've been able to send a secure, HIPAA-compliant, private link to people that live 3 counties away for their mental health appointments, so that at the time of the appointment, on their smartphone, on their tablet, on their laptop, they press that link and they're automatically, here we are. So we've done appointments like that with some youth at their, or we can text them like, hey, I'm at my soccer practice and can I, this just happened, can I chat with you? We always tell them we're not a crisis services, we're not always able to respond, but because we have this ability to text privately or securely, and video conference securely, it makes that communication a lot more stable and reliable for them. With the understanding that, hey, if we may not be able to get back to you for a day or for a couple of hours, so if you're feeling unsafe, here's what you do, that sort of thing. Are there any questions about that particular relationship that we established to reduce those barriers? Yeah.
That all sounds amazing, and I think you're really meeting people where they are, which is rule number 1 for mental health in general, I think, and that's incredible. But I used to be a counselor, and I know like I worked really hard on meeting people where they are, and I feel like I got burnt out pretty fast. So what are you doing as counselors, as people who are helping, this community that's going through so much, every day, every moment, like what are you doing to help yourselves kind of prevent that burnout?
Yeah.
I'm a self-care queen. That's what I call myself. If I have 5 minutes, it's going to be in my car with the eyes closed, listening to some kind of music. I think sometimes I have too much self-care because I overcompensate, because I know that the population I work with is very crisis-y.
Yeah.
Oftentimes I find myself, I can tell myself, no, Rachel, don't pick up the phone, right? It's 11 o'clock, but you don't have to pick it up right now. Like, they have the resources, I can call them in the morning. If something really bad is happening, they know what they can do. And so recognizing that I'm not a crisis counselor, like Will said, and taking that step back, I think has been a huge help for my mental health, my stress level, but like my bio said, I'm really into the holistic. I work out regularly every day. I'm also a fitness instructor, so I have to do that for myself. But just being able to have like a listening ear and talk to Will about the case management, and just recognizing when I need to take a step back, I know is huge for me.
Yeah, I think accountability is important, and Tyler, Rachel, and I are part of the LLC that we just started, so accountability can look like, we joke around about this, but we're kind of serious. All three of us are unable to say no to things.
Yeah.
And so we joke around about taking turns with each other's phones for a week. Every week we rotate. We don't do this, but it would be nice. And when you have your own phone, you can say yes to things. When I have Rachel's or Tyler's phone, everything is no. I'm sorry, the Dalai Lama cannot meet with Tyler right now. We have to say yes. So being able to say no and having people that keep you accountable is really important for that. The other thing is that the Northwest Alliance contract with us, we were able to negotiate and say, look, your population is high risk, high need. Therefore, when we have a consult with your case manager, or when we go in and talk to your endocrinologist, infectious disease doctor, about, hey, can you start them on a antidepressant or an anti-anxiety medication? Are you comfortable with that? Yes, we're comfortable with that because you're their mental health professional and we can consult with you, but we've negotiated that we can get paid for that. And that's something that Medicare would never be able to have us do, or Medicaid doesn't allow private practitioners to do that. So it's provided that it is part of the self-care to say this is what our services are worth. And this population, the trans community, the HIV positive community, the LGBT, the queer community in general deserves quality mental health care. So we deserve to be paid for providing that, but they deserve to have it, to have access. Yeah,
I was going to kind of piggyback on what she said. There's not enough trainings or people, supporting and helping all the therapists that are working so hard to get sped up, to understand what's going on.
Yeah.
Very well-meaning, empathic, very strong-willed people. And so I would love to see, again, something like more trainings that talk about boundaries, expectations, self-care, and really focusing on that, not leaving out what you guys are talking about.
Yeah.
But understanding this is really, there's so many tiers, there's so many people that want to do so many things that just we're burned out in other ways, that it doesn't even have to do with this population.
One of the things that the LLC focuses on that we just formed is we understand that we can work smarter by providing supervision and consultation to providers that are interacting with people all the time. So instead of having therapists call and say, the youth that I have been working with for 2 years just came out as questioning their gender identity, or would like to transition, or I'm meeting with mom and mom just came in and said, my son just came out, and so can you start working with them? Well, how can we help you through consultation, through supervision, through replicating those services and increasing the competency, raising the level of all ships, so to speak, in our community, instead of let's just have 2 or 3 people that specialize in this area in our community that everybody goes to. I see hands going up and thoughts. Our community a couple of years ago just started a coalition. It's called Erie County Coalition for a Trauma-Informed Community. It is great in some ways. It has raised the understanding that people are affected by trauma, and people's behaviors quite often are explained by the experiences that they've been through, rather than lack of character or because they are fill in the blank. It's because of what's happened to them, not what's wrong with them, that these things make sense. So that has increased, and there's billboards and there's trainings, but one of the things that has done that I think is an unintended consequence is it's then flooded the providers of services, of trauma-focused and trauma-informed services in our community. So therapists that are trauma-informed or do trauma-focused therapy like EMDR or trauma-focused CBT or whatever are flooded with the need, and the insurance companies or the insurance providers are the providers that go to the insurance companies and say, hey, I need to be reimbursed for more than 2/3 of what a private insurance policy would pay. They're just like, well, we just don't have the resources. And so it's created this need, an understanding of this is what I need, but it hasn't provided enough training and enough support for those mental health professionals. So that's one of the things that we see needing to happen is as people become more aware of trans youth and more trans youth feel comfortable to say, or non-binary youth, or people feel more comfortable coming out, it doesn't necessarily make the spaces any safer or any more competent. It's just creating a need of, well, what do we do? So creating spaces for consultation for well-meaning people to say, I need a safe space where I can ask this question. And
Trying not to reinvent the wheel, but instead maybe make it more stable, add those resources. Because if we try to redo everything or give everybody those services, it's that burnout's going to happen. Like, I mean, we are a city in crisis with a lot of things, and so we just don't have the manpower and the resources to, you know, like do everything all at once. So, yeah, I think going to those people and saying, well, let's give you some training and let's make you competent to do these things.
We need more crisis workers too.
Yeah. So, real quick, just to touch on some of these, because we are down to 15 minutes, and I wanted to have an opportunity for you all to think about some of the needs in your community. We were going to take some time to break out and have you do this in groups, but I think we'll just do it as a large group. So a regional gender sexuality alliance, GSAs are shown through research to provide safety. Even their existence increases safety and likelihood of LGBT youth to complete school, to be able to feel safer at school, to earn higher grades, and improve all of those mental health markers overall. A lot of our schools in Erie County do not have the resources to create or maintain a GSA. And so what GEAE did is we found some grant money to start a regional GSA where once a month we would, and in the grant we wrote things like transportation costs, we wrote things for emergency counseling to be provided, and we wrote in things into this grant that would help us start resourcing schools that had GSAs but needed support, or youth in schools that didn't have a GSA, to gather, meet other like-minded youth, learn about different resources in the community. The Erie County Library got huge funding to redo part of their library and opened a youth center. A couple of the people in charge of that have been really friendly towards creating safe space for LGBT youth. Just this past year, the monthly GSA meetings relocated to the library and have, it provides a much safer space for kids to say, hey, can you drop me off to the library, as opposed to, hey, can you drop me off to this gate thing with other youth, and parents are like, what are you talking about? But going to the library is maybe still a little weird, like why does my kid suddenly want to go to the library? But it's a safe place and people know what the library is, and so things like that. So there are a couple of different things, areas that we've been advancing slowly and building collaboration. So we'll come back to this in a second. Just points that we want to remind you of from our experience is that community transformation is a slow process, and like we said at the beginning, that's not always a great excuse, or that's not always a great thing to tell people when they're in crisis or when they're in need for particular people. But understanding as community advocates and community educators that this is going to take a while and that we cannot do it all on our own. So self-care is important. We can't do all things for all people. And in fact, there are other people in the community that can do a better job than I can at everything. So how do I empower those people? How do I build bridges with those people? Even the people who I don't like, who I don't get along with, they are important in the community for reasons. And so I need to learn how to build bridges with them, give them their space, and work through those issues for the sake of the community. Yes, yeah. So with that said, I think we'll just open it up for questions either one of us or from your thoughts.
So question, going back to your initial survey, you said that non-white respondents were very underrepresented.
Mm-hmm.
So I know you didn't reach them or they didn't respond. And that was kind of like the last thing you said about it. So I was just wondering what happened next regarding that population. Was all of this built on the responses that you were able to get, even though it didn't include?
So some of it resulted in going back and having further conversations with key stakeholders that work with people of color in the queer community, or going to, part of the problem is sitting on various task forces and committees and things like that. Committees often want, well, let's get at least one trans person. Let's get at least one Latino or Latinx person represented. Let's get at least, and so it becomes this, how do we get their voices to the table? But it has to start way before that in building relationships. And so what it told us is we don't have relationships with people of color in the queer community. We don't have a lot of conversations going on with the Muslim community, with different sections of our community. It's very segregated. Even though there are large numbers of Sudanese, Bhutanese, refugees, immigrants pouring into our city, they are in barrios and they're in neighborhoods, and they are very segregated, and first responders have difficulty breaking down those barriers. Domestic violence, any service provider really struggles with how do we find an interpreter that isn't part of the community to speak to individuals in their time of need. How do we have those conversations beyond the first obvious level of intersectionality? And so building relationships has been where we've tried to start building those bridges. That's a good question. Oh, thank you. Other thoughts or questions? Are there similar processes going on in your community, or similar needs, maybe that aren't specific to HIV positive people or mental health or youth or older adults? Are there it seemed like a number of you are from Allegheny County or city of Pittsburgh proper. Are there consortiums or roundtables or places where conversations are happening in your community?
I can't speak for the community as a whole. I'm the inclusion director at Pittsburgh Mercy. So basically what you guys have been working on, we're trying to do that within our organization. And the main difficulty for me is establishing relationships again within the city of Pittsburgh. It's been kind of some disconnect with certain communities with mental health in our facilities. And my goal is to make it more organic and, to be honest, be real and say not just like, oh, we need this group,
Right.
but really having those conversations, and organizations really need to start saying, what can we do for you, as opposed to this is what we have and how does it fit with your needs, but kind of just flipping out and then on the side and just really just starting all over again.
One of the things that was mentioned at the cafe that we've been hearing a lot in our community is there are parents of trans and transitioning, questioning, queer youth that just have these questions or going through this mourning process that they don't necessarily feel like they have a safe space to ask those questions or to mourn. Even if they are supportive, they're still going through their own process. And they don't feel like they can impose upon spaces that are for trans people transitioning, supportive of them. They don't want to say, I'm here because my child is transitioning and they need support and networking and to meet other people and so am I, but I have all questions and so let me take over the space for myself to meet my own needs. And so we just recently identified that as a need that we were blind to probably a couple months ago. Another space that we haven't been able to make inroads into, we mentioned the community shelter services, but that was actively hostile towards trans people for a number of years. A lot of them are based out of deeply conservative religious communities. I'm fully aware that not all religious communities are actively against trans people. I want to be careful saying that. However, in our community, there was a lot of actively anti-trans, anti-LGBT activity going on in community shelters, either supported or encouraged by employees or administration, or when people would come forward and saying I'm being harassed by other residents or shelter participants, would be turned a blind eye. We just last month were able to have a conversation with a new set of administration that took over, and their initial response was kind of defensive. They're like, well, we are trans friendly now, or we're at least we know that there were problems and we got rid of all of these problems, and so now it's often a conversation. That point of defensiveness is really a learning opportunity. It's a moment of, if we approach this right, it really helps to say, this is a safe space for you to answer or ask your questions. We don't propose that we can speak for every trans person, every LGBT person. However, you have questions. Yes, you may be open. We know that the experience is not translating to the people that need these services. They don't trust you anymore, not because of you personally, but because of the history that your organization has perpetuated violence against trans people.
And I think it's hard too, because we talk to like different agencies and things at meetings, and bringing up like, these are concerns that we have, and we do get a lot of like, well, we've been trained. We've had people come up and train us, so like, we're good. Sure, we could learn more, but like, we're good. And it's like, but like, turning down any kind of extra training or any kind of extra support, it's like, you're limiting yourself. You're limiting the care that you could have for your clients, for your patients, for that safety. And so that's been trying to like, instead of having like that whole group, nobody wants to admit in front of anybody else that they could maybe be a little less competent than they could be. And so having those one-on-one conversations, those closed-door conversations of being like, this is a safe space, just like let us know, and we can help however we can help.
I was just going to say that I feel when you were talking about the parents, that's my concern is having a few experiences where the parent says, here's my kid, do therapy with them, right? Whether they're in agreement with where they're at or not, but like those under 14 kids, that's really a frustration of my own because the parents probably need more therapy than the kids, right? We all know that. And they have gone through 3-4 levels of trauma themselves, the parents. They're saying, I'm fine, and they're like really not even close to being fine. And so my frustration is including the parent, they don't come in, they don't want to come in, and then that client is like, why should I bother to talk to you? Because you're not going to make me be you're not going to get me to surgery. I'm under 14, or you can't make my mom sign the percent paper. Mm-hmm. And I think my frustration again is that those parents need more help. They need more support, but they're either not going to go, you can't make me, or they have to stay strong and pretend that they're stronger than they really are.
Yeah.
So it's hard to break through that open.
And I think they kind of made fun of it after a while about the third or fourth time they mentioned it.
Yeah.
This morning about motivational interviewing being really key, and just being frank and having frank conversations with parents. Like, this possibly is a matter of life and death for your child. Let's just start there and let's be blunt about it. Where are you as far as being able to listen and learn from that standpoint? If we're talking about life and death, where are you? And of course, not saying that necessarily in the presence of the 11 or 12-year-old, but just being very frank and starting, where are you in that stage of change? Are you pre-contemplative? Then how do we work together with your client, with your 11-year-old? How do you give that 11-year-old voice, empower them to advocate for themselves in their family system? How do you do that and strategize with them and say, yes, maybe I can't get your parent to sign off on that paper, but I bet you we can if I can help you not slam your door and cry for 3 days. Right. If we can help you articulate very clear reasons based on what they need. Again, it's putting the burden on the vulnerable youth, but at the same time, if you're an ally, if you're empowering them, if you're strategizing with them, it can be seen as, let me go talk to my therapist so I can strategize with them to figure this out. So, yeah. All right, I think we're out of time, so we'll stick around for a few minutes to talk to people. Thank you very much for listening.
Thank you.